All new tonight, COVID hospitalizations are on the rise according to new data released by the CDC. This as health officials in New York City say wastewater data shows COVID cases there may be increasing again. I spoke with local researchers who say a 100-year-old drug may be the answer to fighting back against COVID.
Everyone knows someone impacted by COVID, the infection taking many lives and changing even more.
And just explain why this work is so important and really how you hope this will help people moving forward.
Now, Jonathan Dordick, Institute Professor of Chemical and Biological Engineering at Rensselaer Polytechnic Institute, is using his skills to fight back.
We as a country are underinvesting in being able to attack infectious disease. It became obvious during the pandemic. I want to make sure we have something in the arsenal that we can go forward with that's going to be able to make a difference because this will impact people's lives. It impacts the economy and everything we do.
That thing that makes a difference, he says, is suramin. Dordick and his team of researchers say the 100-year-old drug used for human sleeping sickness may prove just as effective in preventing and fighting off COVID.
It effectively gets in the way. So when a virus infects a cell, so in the nose or the mouth or wherever, the virus has to bind to the cell surface. And when it binds to the cell surface, ultimately it makes its way to a given receptor. And then when it hits that receptor, it gets taken into the cell, and that initiates infection. If we could block it anywhere along that pathway, then the virus is not going to get into the cell. We prevent infection.
So it has 532 individual wells, and the printer is dispensing 1 microliter of solution into each of the wells.
The team using top-of-the-line technology to aid in this groundbreaking discovery.
Well, the volumes that we work with are very small, and the sample, we can test a large number of samples at once. So it really speeds up the research that we want to do, like for example, for testing out antiviral compounds and other antibodies, things like that.
Well, suramin is an accepted drug in Europe. Dordick says more testing must be done before the drug is deemed safe to use in America to treat COVID.
A larger scale toxicity study would of course have to be done, as well as an efficacy study.
But says he feels the work being done in this lab is a step in the right direction towards keeping everyone safe.
If you can block a virus from infecting someone, you've won the battle.
Dordick goes on to say that he sees the drug being used as a nasal spray to fight against COVID and possibly more. He hopes it will also prove effective in treating other viruses like RSV down the road.